Good morning. Welcome to the first session of the morning. This is preparing for the end of the public health emergency. I am Chanda Freeman, the Health Advocacy Program Manager for the Tennessee Justice Center. For those of you who don't know, THCC is a Nashville-based nonprofit organization who advocates for healthcare and nutrition policies that ensure that all Tennesseans have access to quality, affordable healthcare benefits and services. And I will be your moderator for this session. The COVID-19 federal pandemic, or the PHE, is expected to end in the coming months. And at that time, Tenncare members will begin to go through the state and federally required redetermination process to determine continued eligibility for Tenncare. Tenncare has estimated that 300,000 will be kicked off of the program after the redeterminations. The Centers for Medicaid Services, or CMS, has released guidance to the states, but states are not required to publicize their unwinding plans. And that is of great concern in Tennessee, especially given Tenncare's past performance. Further, it is also uncertain to what extent that CMS is gonna enforce these rules. National experts are encouraging state-level advocates to be diligent and monitor the disenrollments, since there will be limited transparency in data. Today, our experts are going to provide information about Tennessee's unwinding public health emergency, the impact of the unwinding public health emergency on rural hospitals. They're going to assess concerns of eligible Tennesseans for losing Tenncare benefits, and they're going to discuss the implications for the emergent need of expansion in Tennessee. Our speakers today are Emilie Fauchet.
Just couldn't see your beautiful face, that's all.
All right, our speakers today are Emilie Fauchet and Kinika Young. Emilie is the Assistant Director for the ACA Navigator Program at the Family and Children's Services. Emilie has worked in a variety of capacities, assisting individuals with Medicaid, CHIP, and marketplace cases in Tennessee for more than 7 years. Emilie holds a BA from the University of Rochester. So welcome, Emilie. Our next speaker will be Kinika Young. Kinika is a lawyer and health policy advocate who frequently speaks about issues concerning access to healthcare, and she focuses on the role of public health benefits to help people who lack adequate resources to meet their needs. Kinika is the Senior Director of Health Policy and Equity at the Tennessee Justice Center, where she leads the efforts to build a movement across the state to protect and strengthen the safety net for children, families, and seniors, and people with disabilities. Emilie is going to be our first presenter of the day. And just a note, our panelists will be answering questions, but they will answer those following the presentation. So for folks who are in the audience, please hold your questions until then. And for folks who are attending virtually, we're asking that you use the chat feature to ensure that your question is answered. So now we're going to introduce our first speaker of the morning, and that is going to be Emilie Fauchet.
Good morning, everyone. Let me make sure I'm standing in the right place for this. Okay. As was mentioned, my name is Emilie Fauchet. I'm at Family and Children's Service with our ACA Navigator program. We're a statewide program that helps people enroll in Medicaid, CHIP, and marketplace health insurance. And today I'm going to be speaking a little bit about what we know about the unwinding process, specifically here in Tennessee for Tenncare, and a little bit about what we can do as advocates to help people prepare. So I'm just going to talk about the public health emergency enrollment protections, Medicaid unwinding, and how you can help. So what do we know? We know that effective March 18th, Tenncare and CoverKid terminations have paused with a few exceptions. So some people are losing coverage during the public health emergency. That includes people who voluntarily terminate their coverage, people who move out of state, pass away, or are erroneously enrolled. Also, for CoverKids enrollees, the protections are a little bit different than for Medicaid. So for CoverKids, which is Tennessee's CHIP program, enrollees who are pregnant at the end of their 60-day postpartum period can lose coverage, and children who age out of CoverKids at age 19 also can lose coverage at this time. Also, for people who have a presumptive eligibility, this can include hospital presumptive eligibility, pregnancy presumptive eligibility, breast and cervical cancer program presumptive eligibility. Anyone in those presumptive eligibility categories, if they don't also complete their full application and full approval, then they can lose that the coverage will end at the end of the presumptive eligibility period. In addition to ending terminations, as we all know, the renewal process has paused until the end of the public health emergency. One thing that is also happening now, in addition to those few terminations, is that preterm packets are being sent out. So you may have talked to people who said, oh, but I did get a renewal packet. Oh, but I am losing coverage. That's because Tenncare is sending out these preterm packets. According to CMS guidance, they state that states should be transitioning members to different categories as long as those categories are within the same tier level of coverage. So, you know, this means someone might transition from being in the child category to the parent category, but also it can affect their coverage a little bit. For example, Medicare savings program and with Medicare is considered to be the same level of coverage as Tenncare. So if someone had full Tenncare benefits in a Medicare savings program and they're no longer eligible for full Medicare benefits, they could actually lose their full Medicare benefits, full Tenncare benefits because they have the Medicare savings program and Medicare, which is considered equivalent level of coverage. CoverKids is not the same tier level of coverage as Tenncare. So they cannot transfer children from Tenncare to CoverKids. But because Tenncare is a more robust tier level, you could transfer from CoverKids to Tenncare. Those preterm packets, the reason I like to mention this is they're very scary looking because this is an actual redacted version of a packet that one of our clients has received. And you can see at the top there, it says, your coverage will end soon in big bold letters, which is very confusing because it's not a termination notice. Tenncare also has to send a termination notice before they terminate anyone's coverage. This is not a termination notice, but they this is just Tenncare's way of seeing if they need to switch them to a different coverage category. So we are seeing a lot of people get these packets right now, and they do look very similar to renewal packets. The preterm packets in the past were only like 1 to 2 pages of questions, and now they're much more robust. They're like 5 or 6 pages of questions that people need to fill out and send back to Tenncare in order for them to be accurately continued with coverage. So we are seeing a lot of clients that get these packets and think they're losing coverage. It's not necessarily true that they'll lose coverage. Even in many cases, with the exceptions of the categories that can be terminated, if they didn't fill out the packet and send it back in for whatever reason, they would still continue with their coverage. In many cases. For example, you can see this preterm packet is for a 1-year-old and a woman whose 12-month postpartum pregnancy coverage is going to end. Because they're both on Tenncare right now, their coverage isn't going to end even if they forget to send in this preterm packet. But it's scary because it says your coverage will end soon. So this is something we're seeing right now. And so education around how these packets work is important as well. But what about the actual unwinding? So what we know is that the renewal process will restart at the end of the public health emergency. I think everyone's pretty much aware of that. since the beginning of the COVID-related public health emergencies, there's many different public health emergencies going on, but we're speaking specifically today about those COVID-related public health emergencies that have come with those requirements for Medicaid programs to implement certain policies. So the first one started March 2020, and every 90 days, those COVID public health emergencies have been renewed. The current public health emergency that's COVID related goes until October 13th, but we already know that this will be extended again. And that's because CMS is required to give Tenncare a 60-day notice before they have to start the renewal process again. So that Tenncare has 60 days to scramble and get everything all ready. They did not receive that 60-day notice 60 days before October 13th. So we do expect this to be extended again. Another 90-day period would put us back into January. So that's kind of the time frame we're expecting as of right now. But obviously we can't say anything for certain. Once the public health emergency ends, Tenncare must initiate the renewal for all enrolled members within the first 12 months. So that means that they have to at least send out those renewal packets and start the renewal process for everybody within 12 months of the public health emergency. So that's, a full year sounds like a lot of time, but it's actually for the amount of people enrolled in Tenncare is a lot of work to do within just 1 year. We do know that the renewals will be done in batches. For the most part, it's according to the month that they were originally slated for renewal. So let's say someone had Tenncare coverage and they were due to be sent out a renewal packet in June 2020. They were not sent a renewal packet in June 2020 because of the public health emergency. So then Tenncare pushed out their renewal to June 2021. June 2021 came around, still couldn't send it out, so they pushed to June 2022. June 2022 came around, still no. So now they've been pushed out to June 2023. So that person's renewal date is for June 2023. Depending what's the situation in June 2023, they could be pushed out again to June 2024. Or even if, let's say like the public health emergency ends July 2023, but they were due in June, they would still be pushed out to June 2024. So it's just it's for the most part, there are some exceptions to this, but it's based on when they were originally slated to receive the renewal packets. And in the past that was done in a batch system. So we might see 20 or 30 clients calling us and all telling us the same date that their renewals is due. So we expect to see that again. The trouble with that is there is not a very clear pattern to that. So we often would get a lot of clients calling and saying, my sister, my cousin, and my neighbor all got a renewal packet, but I didn't get one. Like, am I supposed to be renewing? What's going on? It's very confusing because it's not done by neighborhood or zip code or anything like that. Name, last name or anything. So it can be really confusing for clients who see a lot of people around them getting those packets, but they haven't gotten them. Okay, so what is this process going to look like? What we know so far from Tenncare. The first step is when someone is up for, so what happens when someone's up for renewal? Someone's up for renewal, Tenncare is going to take this first step, which is called an ex parte review. Basically, they compare the information in their system with the information that they are allowed to access in other systems such as SNAP, IRS, Department of Labor, Equifax, and the Social Security Administration. So they do compare the enrollee's information with information available in any of those systems, if the enrollee gives permission for them to do so. If that data matching works and all the information looks the same, Tenncare will just send a notice to that person and say, you've been renewed again, your coverage will continue. If they're not able to renew someone successfully through the ex parte review, then they go through that renewal packet process. So first thing that's going to happen, let's say their ex parte review is not successful. Then they're going to be sent out a letter, like a one-page letter that just says, expect to receive a new renewal packet. We're going to be sending you a renewal packet. This is a new step of the process that was not in place prior to the COVID-19 pandemic. So Tenncare's intent with that is to try to capture addresses and make sure that people are aware that those packets are coming. And then they'll be sent out the renewal packet next. They need to, that renewal packet will be pre-populated with the information that Tenncare already has in the system. So if everything looks correct to the person, they can just check, yes, yep, this looks all good and send it back. But if information is changed, then they would have to indicate that in the packet as well. Importantly, if someone has signed up to only receive electronic notices, they are not going to get that packet in the mail. They're actually only just going to get an email that says they need to check their Tenncare Connect account, and the letter will be there in their Tenncare Connect account if they've set up an account and requested to receive electronic notification. So it's important to know that some people may not receive a paper renewal packet, even though they need to fill one out. So then once they receive the packet and fill it out, they need to return it. They will have 40 days from the date of the packet in order to return the packet to Tenncare, and that specific date will be listed on the packet. They can be filled out via phone by calling Tenncare Connect account with Tenncare Connect. They can be sent back in the mail. They can be done in person at DHS offices. They can be sent back by fax or by filling it out on the online accounts. There's actually a tab to be able to fill it out, similar to fill out an application. We super recommend that if possible, people send them in by fax or online. That way you have a record of sending that renewal packet in. I always recommend to people never to mail anything to Tenncare. In my personal experience with clients that I've worked with, that just never works out, and then you don't have proof usually. And I've heard from other advocate organizations that the mailing things can be a barrier for some people because of the cost of postage or the cost of, especially if you want to send it certified mail. So we really recommend by fax or online if possible. And obviously that's not possible for a lot of clients. People don't have access to fax usually these days. And the online accounts, are difficult to navigate and can be a barrier for a lot of people who don't have internet access, who don't know, who don't have an email address, who don't know how to navigate online websites. So we really recommend people work with an advocate, either at Family and Children's Service or THCC, Tennessee Justice Center, the FQHCs. There are lots of places that help with enrollment. So while we do this work, a lot of other people do this work too. So working with an advocate to help them send it by fax or online would be best. Then the eligibility notice, if Tenncare does not receive a renewal packet, they'll send a letter notifying the client of their canceled coverage. That will be sent 20 days before the termination date. And the member can still send the requested information up to the date of termination. And then also, if a client does not return or returns a renewal packet within 90 days of their termination date. So let's say they are sent a letter saying you've been denied, your last date of coverage is October 20th, 2023. And then in November, they fill out their renewal, they actually can be reinstated with their coverage. I'm just going to keep going and pretend that didn't happen. States are required to transfer to the marketplace electronic accounts of beneficiaries whose states assess are potentially eligible for coverage. What this means is basically if Tenncare ends the coverage of somebody because they don't appear to be any longer eligible, but that person looks like they might be marketplace eligible, Tenncare is required to send that information to the marketplace. What we've seen in the past is then the marketplace sends a letter to that patient or that client saying, okay, we've received your information and started the application for you. You need to contact us to finish your application. So it's kind of confusing because that letter then comes from the marketplace, and A lot of times clients get a little bit confused, like, what is this? How is this happening? So just to be aware that they are required to kind of close that loop to make sure the person, if they're eligible for any other coverage, can continue with coverage. But this will only happen if they've gone through the renewal process and been denied because some sort of circumstance change that they're no longer eligible. If they just don't send in the renewal packet, they're not going to be sent to the marketplace. It's got to be that Tenncare sees they're no longer eligible for Tenncare and that potentially could be eligible for marketplace. Okay, so what can you do as an advocate? Share this information, let people know what to expect with the process, how that might go down, what the dates look like. Also making sure people's information is up to date with Tenncare. This is huge. This is CMS's big message right now, Tenncare's big message. I think Kinika is going to mention it too. People are not going to get their renewal packets unless their address is up to date in the Tenncare system. Right now, they have to call Tenncare to update their address. They can't call their managed care organization. So making sure that people update their address online, by fax, or by phone with Tenncare in order to make sure that they get their renewal packet. It's been a long time now, almost 3 years. People move a lot. So making sure that address is up to date is the key. Is definitely key. Opening all their mail from Tenncare, checking, have they gotten a preterm packet? Have they gotten a letter that says they're going to get a renewal packet? They need to be opening their mail from Tenncare. And then if they're able and they want to set up a Tenncare online account, we found as advocates that these accounts are really helpful to understand exactly what's going on with somebody's case. We can see if they're up for renewal, when they're up for renewal, what letters they've gotten. They can fill out the renewal right there online. So obviously this is not an accessible option for everybody, but for those who can set up an account and do feel comfortable doing so, that is a great option as well. These are some outreach resources. CMS has an unwinding page. Tenncare has its own unwinding page. And then of course, Family and Children's Service, THCC holding this conference. TJC is working with me today on this panel, and we all provide assistance with all of this as well. So I do recommend going to the CMS page and the Tenncare page to find, they've got flyers, social media, information for clients, information for advocates about how to prepare people for the unwinding. Okay. And I think I didn't have a time, but I hope I didn't take too much time. This is my contact information. Please feel free to reach out to me with any questions. And obviously we'll take questions at the end during the Q&A portion. So do hold your questions and I will turn it over to Kinika.
Thanks, Emilie. Good morning, everyone. I'm Kinika Young. Am I in the frame? I can't see, so hopefully I am. So Emilie did a great job of talking through the mechanics of the unwinding process. And what I am going to do is talk a little bit more about the implications of the public health declarations. Now I'm going to open up my slides. I can get them. And then share. Are they already open? Okay. Here we go. I don't think I'm sharing with the audience though. Sorry about that. We could see them. Oh, could the audience not? Oh. Oh, sorry to the people on Zoom. If you didn't see any of Emilie's slides, hopefully you'll receive those after the conference. Am I still in the Zoom? I don't see. Okay, I see it. I see it. Okay. So, share. Technology, people, and start from the beginning. Okay. So if someone's on the Zoom, And you're able to confirm that you can see. Okay, thank you so much. All right, here we go. So I'm going to talk a little bit more about what's transpired during the public health emergency, specifically what the state was required to do by virtue of the laws that were passed in response to the pandemic. So first, there was the Families First Coronavirus Response Act. It provided a 6.2 percentage point increase in funding to states for Medicaid spending during the public health emergency. There was just an anticipation that there would be a greater need to meet people's healthcare needs during the public health emergency. So the federal government decided to give extra funding to the states to kind of cover that. And so as a condition of that extra funding, states had to promise to provide continuous eligibility. So that's what Emilie was talking about in terms of not being able to terminate people with certain exceptions during the public health emergency. So this increase was reflected in the state's federal medical assistance percentage, or FMAP, and it stays in place. That 6.2% point increase stays in place until the end of the quarter in which the public health emergency ends. So if it ends, I forget how quarters run, but if the PHE ends at the beginning of a quarter, that additional funding will still last to the end of that quarter. Also, states cannot make it more difficult for people to enroll in Medicaid, and they must cover coronavirus testing, COVID-19 treatment services, including vaccines, without cost sharing. So this has been really important to help states navigate this difficult time and make sure that people can get their coverage as they would need during this public health emergency. So what that's meant for Tenncare enrollment is that the roles have really increased during the past couple of years. So at the beginning of 2020, before the public health emergency really was on the map, we had about 1.4 million people across the state enrolled in Tenncare across all categories. Fast forward to July of 2022, which is the most recent month that Tenncare enrollment data is available, we have almost 1.7 million people on Tenncare. This increase is solely because of the public health emergency. There are no new people eligible for the program. These are people who were already enrolled in Tenncare and people who have applied and become enrolled during the public health emergency. Some of those people who were already enrolled may no longer be eligible, but because the state isn't allowed to terminate people, we've seen this increase in enrollment because people are not rolling on and off of the program. So Emilie mentioned that there's an exception. If the person was determined not to be validly enrolled, they would be able to terminate the person from Tenncare, but otherwise they keep their coverage unless they voluntarily withdraw or move out of state or pass away. So the increased funding that the state received has equated to over $2.1 billion in fiscal relief. And you compare that to the $764 million that the state has spent thanks to that additional, what we call maintenance of eligibility enrollee bump. There's still a net windfall to the state of about $1.4 billion. So that's $1.4 billion additional dollars that the state has incurred during the public health emergency just by virtue of that additional 6.2 point percentage bump in the funding. So another impact, in addition to pausing terminations and the increased funding, the public health emergency declarations opened up a menu of flexibilities to help deal with the pandemic. So they fall in two different categories. One is what's called an 1135 waiver, and then the other was under the CHIP, called the CHIP Disaster SPA or State Plan Amendments. So currently, as a result of that PHE declaration, the state has taken advantage of the 1135 waiver process to waive the limit on the number of services or number of patients served for out-of-state providers. They've ceased the revalidation requirement for providers. They're also allowing out-of-state certified providers enrolled in another state Medicaid program to serve people in Tennessee. And they're allowing home and community-based services to be provided in settings that have not been determined to meet the HCBS setting requirement. So that allows services to be provided in other locations that aren't strictly under the HCBS criteria. And they've also allowed services to be provided via telehealth in a clinic practitioner's location or other location to be considered provided at the clinic for purposes of reimbursement. Then on the CHIP disaster side, they have waived cost sharing for all services related to COVID-19 testing and treatment. They've waived requirements related to timely processing of applications and renewals, which is not necessarily a good thing, but that is something that has been provided as a flexibility because of the administrative burden of doing those things. And they have been allowed to delay acting on changes in circumstances affecting eligibility other than the exceptions that we mentioned earlier if someone is no longer eligible in the state. So technically, once the public health emergency ends, all of these flexibilities would go away, but the state could choose to extend them if they wanted. So what are some challenges and opportunities related to the unwinding of the public health emergency? Emilie already did a great job of covering the importance of current enrollees updating their addresses, because we know based on past experience that once the state restarts the redetermination process after they've paused it for a while, there are going to be people who fall in the gaps because they have moved, or they don't understand the information that they receive. And so communication and contacting people to let them know that they have to renew their coverage is really, really important. Even once someone knows that they need to do this, there still might be some challenges for people who have limited literacy or don't speak English as their first language, or for whatever reasons, they can't complete the renewal themselves. So we need to be proactive in making sure that people know where to turn if they need assistance with completing the renewal. We also know that there's going to be an issue in terms of people transitioning to other forms of coverage because Tennessee has not expanded Medicaid. There will be a number of people who could be directed to the marketplace, but they may not be able to get an affordable plan on the marketplace because of the coverage gap. And so those folks will have no alternative forms of coverage. And as Chanda mentioned, it's been estimated at least 300,000 people will be terminated. And so there's a question of whether, how many of them will be eligible for a cost sharing subsidy on the marketplace versus how many are just falling into the coverage gap. We also are concerned about the potential for Tenncare to terminate people who are still eligible. Again, the only way Tenncare can renew that coverage is if you show them that you're still eligible. But there may be people who have trouble doing that, and so they're still eligible, but they haven't completed that recertification to prove to Tenncare that they are. And so those people will likely be terminated. And so those are part of the target or priority populations that we want to reach with this important information. And we're really concerned about this because we at the Tennessee Justice Center are currently representing a class of Tenncare enrollees in a class action lawsuit against the state because of a flawed redetermination process that the state conducted back in starting in 2018, 2019, but the lawsuit was filed in March of 2020 to challenge that flawed redetermination process. So the system that the state has currently in place, the Tenncare Eligibility Determination System, or TEDS, really went online during the pandemic, and it's never been fully tested to see, once we press the button, will this be accurate in processing information and making sure that people are being renewed if they're still eligible. It'll be a surprise for all of us once they have to start using that system for that purpose. And so we want to make sure that people are not wrongfully terminated and getting caught up in this unwinding process. So what we can do, the opportunities that are before the state, would be to make sure that they are communicating clearly and effectively about the unwinding and letting people know that they need to update their address and contact information. I've seen some stuff on their website and perhaps on social media, but we really need to get the word of mouth going because those platforms may not be reaching everybody who needs the information. We also know that there's an opportunity for the state to use all available data to reach enrollees. That includes SNAP files, the Supplemental Nutrition Assistance Program, formerly known as food stamps. If people are enrolled in that program, then theoretically they have their contact information and they can use that to reach them. They also, the state I've heard has promised to work with the managed care organizations or MCOs to reach enrollees, because the enrollee may have provided updated information to the MCO, especially if they're having medical claims during this time. They would have more up-to-date information about the enrollee. And we really want the state to take the time to get it right. As Emilie mentioned, they have 12 months after the end of the PHE to initiate the renewal process for the almost 1.7 million people on the program. And that's a lot of people, but we want the state to really focus on getting it right and not rushing to meet those deadlines and make sure that they don't wrongfully terminate someone's coverage. And then also it's important that we make it easy for people to get assistance with renewal. The best practice would be for the state to have in-person enrollment assistance for folks. I haven't seen those offices operating before the pandemic. They're certainly not operating during the pandemic. And so we don't know if the state will be providing in-person assistance after the public health emergency ends, but that's where you all can step in and help out. And that's where our organizations, the Tennessee Justice Center, the Tennessee Healthcare Campaign, and Family and Children's Services can kind of fill that gap to make it easy for people to get the help that they need. Emilie talked about the barriers that people are facing when it relates to this. And so the people who are most likely at risk of losing coverage, even if they continue to be eligible, include those with limited English proficiency, limited literacy, people who have changed addresses and didn't update it, and people who lack phone or internet access. So again, word of mouth is really important, and that's where advocates like you can step up and help out. Oops. And so another group that's really at risk once the public health emergency ends are people who live in rural areas. And that's because we have a high rate of rural hospital closures in our state. This was an issue before the pandemic, and it hasn't gotten better, except that the federal government did provide additional funding to hospitals to kind of plug the safety net and get us through this pandemic. But this map is showing that there are 23 counties that have no hospital within their borders, and there are a total of 16 closed since 2012. That's the highest rate per capita in the country. Only Texas has a larger number of hospital closures than Tennessee, and that's largely in part to the fact, due to the fact that Tennessee didn't expand Medicaid. So we know that there are about 26 hospitals at risk of closing, presumably if they don't have sustained funding after the public health emergency ends, and 55% of all rural hospitals in the state fall in that category of being at risk of closing. And so hospitals, rely on paying customers to keep their doors open. And once that additional funding that was provided due to the public health emergency and those flexibilities like telehealth go away, then that's going to be taking away a vital stream of revenue for these hospitals and put them back in a precarious financial situation. This is really troubling because of the rural health disparities that we're all aware of. People in rural areas see higher uninsured rates. So in the metro area of the state, they have about a 14% uninsured rate. But when you look at just the non-metro, including rural areas, they have an uninsured rate of over 16%. So there's a disparity there. There's also higher rates of chronic conditions in rural areas, such as diabetes, obesity, cardiovascular disease, and other chronic conditions. And so these are people who really need access to continuous preventative care that's accessible in their community. We also know that there are higher rates of behavioral health issues, such as the opioid epidemic and other substance use disorder issues and mental health issues in rural areas and those needs aren't being met primarily because these people may be uninsured, but also because there is a lack of provider capacity in rural areas. They have fewer providers in the community, especially if the hospital has closed. There's no anchor for those providers to be located in the community. So that's a real problem that contributes to these health professional shortage areas in rural areas. So a lot of this is connected to the coverage gap, and that's referring to the fact that childless adults in our state who are under age 65 and don't have disabilities are not eligible for Tenncare no matter how little they earn. And that's because we haven't expanded Medicaid. Tennessee is one of 12 states that have refused Medicaid expansion. 8 of those 12 states are in the South, and 60% of people who are in the coverage gap are people of color. So this is absolutely a racial justice issue that the Tennessee Justice Center has been outspoken about. So there are over 300,000 Tennesseans in the coverage gap. And we also know that there's about 300,000 Tennesseans who could lose their coverage according to the state's own estimate once the public health emergency ends. And so we're trying to stress that now or never is the time to expand Medicaid. Well, I shouldn't say now or never, but it's very important that we do it now before the public health emergency ends so that we have that safety net to catch folks who will be losing their Tenncare eligibility once the state is allowed to terminate folks. I'm gonna let Chanda cover this slide, but I wanna go here and just show you some resources that you can check out. Again, I'm assuming that you'll get a copy of these slides, but the Tenncare's Unwinding information for partners is a link that you can go to check out what they're planning to do as part of the unwinding process and kind of where they are, what stage they're at during that process. CMS also has some great resources. They have some fundamental actions for states to prepare for unwinding and resources to support state efforts. There's also our website at the Tennessee Justice Center. We have a page devoted to rural health resources, since that's one of the demographics that we think are really at risk once the PHE unwinding starts. And then also I'd point you to the state's latest uninsured adult healthcare safety net annual report, which talks more about what safety net programs and providers are available and where there are gaps where we need to focus more attention. So let me go back and then turn it over to Chanda, and I look forward to answering any questions you might have. Thank you.
All right, thank you to Kinika and thank you to Emilie for such powerful, am I on the screen this time? Yeah, I can't see. For such powerful presentations. Oh, good. Maybe go up a little. Better, okay. All right, so thank them for such powerful presentations. We have heard a lot about the state of the state of Tennessee and the steps that we can take to mitigate that. So what can we do? There's several things that we can do. You know, we can't afford to waste any more time watching our state legislators refuse common sense to provide health coverage for all Tennesseans. We know that lives are hanging in the balance right now, that it is morally and fiscally irresponsible on behalf of our elected officials to leave these lives in the balance like this. So what can we do? We should be reaching out to our legislators right now and letting them know that we want them to close the coverage gap. We should be refusing to leave the money on the table. There's $1.4 billion annually at stake, plus another $900,000 for the first 2 years of expansion. We cannot leave this money on the table. Help hospitals that are at risk of closing. As Kinika mentioned, Tennessee has one of the highest hospital closure rates in the nation. And the ending of the public health emergency, particularly on populations in rural communities, will be felt probably more so than other parts of the state. And we should also be working to close the coverage gap in Tennessee. 300,000 people are hanging in the balance right now. And it's ridiculous. It really is. You know, I kind of feel like, you know, the house is on fire and we always wait on the firefighters to come. But in the case of public health, this public health emergency in Tennessee and the history of our legislators and the history of the efforts in Tennessee, we are the firefighters. The people of Tennessee are calling on you guys to be those ones that are standing in the balance and that are putting those fires out. So we encourage you to hold whole press events or write an op-ed in your community. Hold a virtual in-person learning session within your community. You know, folks will talk about what they feel comfortable talking about. So let's do this. All right. So now we're going to move on to the part of the session that everybody can participate in. And these are our question and answer sessions. So I'm going to hop over to the chat. Stop sharing. All right, I'm back. Okay, so let's see if we have any questions in the chat. Are there any questions in the room? We'll start here. Okay, we'll start with Tony Gar.
Well, I've got quite a few questions, but I'd like to ask this one very quickly right now. Telehealth is due to end also at the public health emergency. That was something that doctors could do during the public health emergency. Telehealth has become very popular, very useful, and has been able to provide access to thousands, millions of people that otherwise wouldn't be able to get to a doctor. So my question is, has Tenncare indicated that they're going to continue telehealth after the public health emergency? And if they're not going to, why not?
All right. Okay, so the question was, is Tenncare going to continue public telehealth? And if not, is there a provision to cover that? So I'm gonna, Kinika or Emilie.
Just say. That is an excellent question, Tony. Thank you so much for asking it. I do not have the answer to that, but I can explore that. I will ask that question to Tenncare. And if I get a response or any more information, I will be sure to share that information out.
Thank you, Tony, for that question. There's a question in the back.
Two quick questions. How the 300,000 people caught in that redetermination and the 300,000 that you're asking, you really think that that number is higher than 300,000 caught in that chat?
So the question was the estimated 300,000 people in the coverage gap, is that the accurate number? And the short answer is it's probably higher. 300,000 was the number before the pandemic started. And so we know people have had, lost jobs or changing circumstances. A lot of things have really gone wrong in the last couple of years. So that number is likely higher, but we haven't seen a more recent estimate. And the 300,000 in the coverage gap is not necessarily the same as the 300,000 that the state estimates will be terminated from. It's actually not the same as the 300,000 that the state estimated will be terminated from Medicaid once the public health emergency unwinding starts. I think that that number is more so based in how many additional people are on the roll. So if you look at the roughly 1.4 million in January of 2020, compared to almost 1.7 million who are enrolled now, that difference is 300,000.
And then my second question is, how much has the federal government paid for people that are enrolled in Tenncare? I mean, you told us how much they pay. They pay it for additional. Is that paying the full amount for those that are newly eligible because of the public health emergency?
So the question was, is the federal government covering the cost of the 100% of the cost of the additional enrollees due to the public health emergency? And the answer is no. The state's matching rate. So let's assume that in normal times, the federal government pays 60% of the cost and the state pays 40%. Because of the public health emergency, the federal government is now paying 66.2% and the state is paying 30, whatever the 6 point something percent less. Can't do the math in my head right now. But there's still a percentage of the cost that the state is responsible for. They're just responsible for a lower percentage because of that 6.2% bump in funding.
Did you have, right here, get your names.
I'm assuming that some legislative changes have to be made in order to expand Tenncare or to keep people on the rolls. So being a person that has to, as a dietitian, we have to prove our worth, not just in there's adding services and quality, but the actual financial benefits and healthcare benefits that we're delivering. So not only do we want to prove that we can keep hospitals open and that we can spend the dollars and that more people are getting healthcare, but I'm wondering if there's any way that we're capturing data on the increased care that we're providing to people. And the actual health outcomes and financial benefits to the state of Tennessee from increasing healthcare. And I'm wondering if that would make a difference as we present that information to state legislators.
So the question, you come, Kinika. You would repeat the question.
I'll try to repeat it. So I think you're asking, is there data on the improved outcomes and financial benefits to the state of expansion? Is that right? Okay, so yes, there are a few ways that we can track that. One is by comparing the situation in non-expansion states to what's happening in expansion states. So we know that expansion states have been able to reduce things like maternal mortality rates. They've been able to reduce incidences of overdose deaths. Various health outcomes. There have been hundreds of studies that show expansion states have really done a great job thanks to expansion in comparison to non-expansion states. And then I think another part of your question is, like, during the public health emergency, are we tracking the data to show that people being able to stay on their coverage is beneficial to the state? And I have seen studies nationally about that. I don't know if they are specific to Tennessee in terms of those benefits, but we do know that having continuous eligibility is best practice for any Medicaid program, because once people have that continuous coverage, they're better able to manage chronic conditions, they're better able to get preventive care when they need it, and not incur medical debt. So yes, there's data to support that.
So we have time for a couple more questions. We have one over here and then the last one there.
Yeah, my question pertains to the, not the $900,000 that Tennessee would receive if they approve Medicaid expansion, but rather the $1.4 billion annually. I thought I had read somewhere, and this is a couple of years back, that amount, whatever a state gets, would be reduced on a percentage basis. And it used to be 10 years. And I wondered, is there a time frame for when that funding ends or is reduced on that percentage basis? Because as I'm saying, I used to work advising health plans. And when we talked about Medicaid expansion, at least in New York, the funding would have been reduced on a percentage basis over a 10-year period. And I don't know if that law is still the same, because I haven't kept up, but I'm curious about it.
Sure. So the question is relating to the gradual decreased funding for Medicaid expansion available to states. So when the Affordable Care Act was passed, the federal government was paying 100% of the cost for those people who would be participating in the Medicaid expansion program. Over time, that dropped to 90%. So we're still at 90%, and that's where it bottoms out. It's not supposed to go lower than 90%, but the actual budget record, vehicle for the existing Medicaid expansion program are done on a 10-year basis. So I don't know when that 10 years is up to be renewed, but Congress would have to renew the budget authorization to continue that 90% match rate, into the future.
So right now, at least 90% is guaranteed for 10 years.
Yes,
It's actually in the security administration line item, so I think it's law permanently, you would have to go. in
right,
and enforce.
right.
Municipal panel, forgot to go in. vote against the state.
Yeah, so the Social Security Administration's budget includes that 90%. They would have to change, basically repeal the Affordable Care Act in order to change that and not renew it for another 10 years. So there's the law that provides the program, and then there's the budget aspect of it. So the budget aspect is what they need to renew, but the law is permanent. They'd have to repeal it in order to not continue to fund the expansion. Sure.
All right, last question, and if we didn't get to your question today, please write it down and get it to me and I'll get it to.
Message in the chat.
Oh, there's a-
Scroll down. Okay.
All right, if there's a question we didn't get to it, please, if you're online, please put it in the chat. We'll have copies of those questions. If you're in this room and you didn't get your question answered, please write it down and get it to me and I'll get an answer for you. Last question of the session.
The 300,000 estimated for determination, do you have another estimate of what you think comes in addition to other coverage like Medicare?
So the question was, of the estimated 300,000 who would lose coverage once redeterminations start, when the public health emergency ends, how many of those will transition to other forms of coverage? I don't have that estimate. And I don't know if the state has provided that, or if that estimate are only people who don't have any other means of coverage. I'm just not sure how that number breaks down. Oh, and we do have a break. So if there are other questions, we don't want to cut the conversation short. So feel free to ask if you don't mind, even into your self-care time. Randall had a question.
Yeah, there is a device, pretty from big we have quite a few advanced age seniors of dual eligibility that lost their premium coverage for Medicare Part B. So they have excluded what to do with the determination package. Is anybody monitoring that?
Yeah.
If you get people that's
Mhm.
beginning to lose some faculties,
Right. So I'll repeat the question for the virtual audience. Randall's question is anyone monitoring the dual eligible population? Because we know from the most recent redetermination period that a lot of people who are on Medicare, but are also eligible for Tenncare and has Tenncare cover a portion of their Medicare premiums. When they had to go through redetermination, they lost their Medicare coverage because they didn't know about the Tenncare renewal. And the short answer is those people are a part of the ongoing class action lawsuit that I mentioned that TJC is involved in. So we are monitoring that as part of the litigation.
Can I add something to that?
Yes.
I just want to add a few things. One, a reminder that for those people who are dually eligible, that is actually an issue now, not just when the public health emergency ends, because Medicare with Medicare Savings Program and Tenncare are considered equal tiers of coverage. If someone who is on a Medicare Savings Program is sent a preterm packet, one of those packets I showed you, it says your coverage is going to end, they actually are at risk of losing their full Tenncare benefits if they're no longer eligible and also have Medicare. So that's actually a great thing to bring up because it's not just an issue when the public health emergency ends, it's actually relevant right now. And also, I'm not 100%, I didn't mention this earlier because I needed some clarification on it, but for those who are potentially Medicare eligible, who have turned 65 since after March 2020, who are enrolled on Tenncare, that's actually a group that's going to be receiving their renewal packets, not according to the month when they're up for renewal, but their Tenncare is going to try to coordinate that to be around the time of the Medicare open enrollment period. So that now they would be eligible as losing coverage anyways, but they're going to try to coordinate that around Medicare open enrollment period in order to hopefully ease that transition for people. I have some clarifying questions about that myself, but just so you know that that's also.
Can I ask a follow-up question to that?
You can.
If someone is losing Tenncare because of the public health emergency ending, and is that a qualifying condition at any time with us for a special enrollment period for Medicare?
So for the marketplace, yes, loss of minimal essential coverage is considered, will open a special enrollment period for the marketplace. But for Medicare, I'm not a Medicare expert, so I cannot speak to Medicare, but I would, you know what, I don't even want to give, I will, do you know the answer to that? Okay, I will check and let you know with our people who do more Medicare work than I do. And I'll get back to you.
Okay, thank you.
All right, well, thank you, everybody, for being here. Let's give a hand to our speakers this morning. And just want to remind you that there is an evaluation in your session packet that we would like for you to complete. If you are online, please take this opportunity to complete the online evaluation. If you are a social worker and you need CSU credit, please see me and sign this form. Thanks again for participating in preparing for the end of the public health emergency. I hope you enjoy the rest of the conference.